We're now advancing to move each segment on a segmental mobility tool called the Mobilization Wedge. This wedge has a gutter that allows for the spinous process of the spine to sit in the gutter so that it is more comfortable and tolerated. And we can do this with the thoracic positioned in a way that we'll get into, but what I want the camera to depict is that this joint that my little finger is pointing to, between this vertebra that's off the edge of the wedge and this vertebra and the rest of them that are on the wedge and stable, will now have mobility between this upper one and the lower one that's on the wedge. And we can see that when this joint, where I'm moving my finger here, that joint is moving, and when the breath is taken and she rises and then relaxing, the joint actually has a gapping or a traction effect to it when she relaxes. And it only moves a millimeter or two, but it is necessary for that motion to occur if we're going to have the flexibility to have good posture and not be slouched. Our good friend Dennis Morgan and I both were in Norway together doing a residency in orthopedic manual therapy, and we had used to these wedges in our treatment areas, but when we came back, the wedges were not to be found, and Dennis was very creative and came up with the idea of taping two tennis balls together so that the patient would have their own tool rather inexpensively to produce the similar mobilization that the treatment wedge affords the patient. So it would be the same principles, and the tape around the tennis balls is 3 circumferences this way and then 3 here. All right, now we take the wedge, and you're going to be positioned in a way that we started, finding the first rib by following the neck. And when you feel the neck with your other hand, and the neck ends right here at your torso. And so right in there, there's something firm, that's the rib. So if the rib goes around and attaches to the spine right there, then we know that would be thoracic number 1. Okay, and then the wedge would be an inch below that for us to address T1 on T2. Okay, now we have a skull hand and a neck hand, and the knees are bent as we did before to protect the lumbar. And then Kate leans back till she feels the edge of the wedge, and my fingers are monitoring that she has achieved that contact. When my fingers feel her make that contact, I let her know that that's where the breathing is to begin. She takes a huge breath, she rises a centimeter, then she relaxes. And as she relaxes, she lets her body lean against the edge of the wedge. And she takes a huge breath in and rises a centimeter, and then she exhales. And as she relaxes exactly where the wedge is contacting her, then she takes away any little guarding of muscles that may occur because they're beginning to move and stretch. And it may be initially uncomfortable with the first breath. Then as we continue, it is less uncomfortable because she's gaining some movement. Okay, after 3 to 5 breaths, 5 if it's not moving enough and she's still uncomfortable, 3 if it's moving well and she's no longer uncomfortable, then we move to the next segment. To move to the next segment, she puts her elbows beside her and sits up, and her pelvis scoots only an inch. And that was 2. Okay, now she goes down gently, And as she does, she should be contacting the wedge at the level immediately below where we first targeted. And then we would reproduce this. Now, it gets a little difficult when we get into the lower spine due to the fact that we have, I'm going to lift you up and you're going to grab a hold. Go all the way up, sit up. When we get to the lower part, then she has this long lever of her trunk sticking out in midair. And that's why it'll be necessary now for her to grab her hamstring with that leg across on her foot. The other hand supports the skull. And then when she rises up, she uses her bicep here to lift up as well as her abdominals. And she takes a breath in, and then she carefully exhales. That's too much. Okay, just a few millimeters every repetition. Also, we have an option if you have a strong neck that you could hold with two legs. So that foot's down, and this hand comes like this, and then that hand is here, and then you breathe in, and you exhale. That's if you have a strong, safe neck, and it's pain-free in the neck. So breath in, and breath out. When a person's tight in the thoracic cage, and they're older, this is a very aggressive, advanced way of doing it, and a patient may not be ready for this for several months. On the other hand, if we have teenagers who have scoliosis and they're stiff where their curve is, they may be getting the wedge assigned to them on day one because their joints are more flexible.